Seasonal affective disorder is defined as a subtype of major depression or bipolar disorder. It is a hard to diagnose disorder because a lot of the symptoms presented in SAD are also seen in other mood disorders such as major depressive disorder. As according to the DSM-5, depression with seasonal pattern and therefore SAD can be diagnosed if these experiences are seen for at least 2 years. These experiences include depression that begins and ends during a specific season every year, and whereby no episodes of depression are seen during the season in which you experience normal mood. And lastly, many more seasons of depression than seasons without depression are seen over the lifetime of your illness. Now, when it comes to the causes of SAD, the causes of SAD can include the lack of light, especially experienced in winter times. The lack of light can cause an upset biological clock that controls your sleep-wake pattern and other circadian rhythms. In addition to this, it can cause problems with serotonin, which is a brain chemical that affects your mood. Lastly, change in season can also disrupt the balance of the body's level of melatonin, which plays a role in sleep patterns and mood also. Some of the risk factors for developing SAD can include being female, being young, having a family history of SAD and another form of depression, having clinical depression or bipolar disorder, and lastly, living far in the north or the south. Treatment for SAD may include light therapy, medication, and psychotherapy. Light therapy, which is also called phototherapy, is a method treatment whereby you sit a few feet away from a special light therapy box which allows you to be exposed to bright light. Now, light therapy has been shown to be effective because it mimics outdoor light and it appears to cause a change in brain chemicals linked to mood. It starts to work only a few days to 2 weeks into the light therapy, and it appears to relieve SAD symptoms. Now, the next method of treatment that may be used is medication, and in particular antidepressants may be used. Lastly, psychotherapy, which is also called talk therapy, is another option for SAD treatment. Psychotherapy can be helpful as it can help the individual identify and change negative thoughts and behaviours that could be making them feel worse, and learning healthy ways to cope with SAD symptoms, as well as learning ways to manage stress. Managing stress can be a major part of recovery, and many are encouraged to take up physical activity and other stress management techniques, such as meditation and relaxation techniques, time management skills, counseling, or group therapy. There are also other things that can help someone diagnosed with SAD, such as making your environment sunnier and brighter by opening up the blinds, trimming tree branches that block sunlight in order to add more sun, and sitting closer to bright windows whilst at home or at work. And another suggestion that would be made for somebody who has SAD is for them to get outside as much as possible by perhaps taking long walks, eating lunch at a park or close to a park, and even in the colder days going outside for a walk whenever possible. In addition to this, there are also other alternative supplements that can be taken, such as St. John's wort, which is a herb approved to be helpful in treatment of disorders. Melatonin can also be used as a dietary supplement that can be taken as a form of a hormone to increase mood. Now, lastly, mind-body therapies have also been found to be helpful. This may include acupuncture, yoga, meditation, guided imagery, and massage therapy. Now, when it comes to coping and support, certain steps can be taken to help you manage SAD, such as sticking to your treatment plan by taking medications as directed and attending therapy appointments as scheduled. Another suggestion is to take care of yourself, getting enough rest and taking the time to relax, participating in exercise, eating healthy, and not turning to alcohol or drugs for relief. The practice of stress management, as mentioned above, is also important because unmanaged stress can lead to depression, overeating, or other unhealthy thoughts and behaviors. Even though it may be difficult to socialize when feeling down, it is also worth making an effort to connect with people that you enjoy being around, as they can often offer support and give you a little bit of a boost when needed. Now lastly, taking a trip during winter to a sunny warm location for a mood boost is also highly recommended if possible. Thank you all for watching this video. I hope you have found this useful, and please do not forget to leave a comment or a like, as it lets me know that what I am doing is worthwhile and is somewhat useful. And if not, I would appreciate suggestions as to how I could improve my content, as well as suggestions as to what disorders I could cover next. Thank you.